So there's an enormous amount of planning that occurs way before you ever see the first printed word. It's really striking. Our next conference is in 2015, next year in May, about the same time. We've already begun planning extensively, so you never really rest on your laurels. And that includes everyone at the grassroots, what kind of symposium you want to put on, how you're going to do your abstracts. There's a very committed group of staff and all of our volunteers and all of our members that start at least a year ahead of time, and more than likely we've been talking about this for 2 years. We are about 15,000 members, and we have, in that order of those attendees, sometimes somewhat less because there are more difficulties with travel, as we all know now. But, and we are a group of very dedicated healthcare professionals to lung health. So that includes physicians and nurses and trainees and students and respiratory therapists and surgeons. There's a lot of us, but very engaged and very active. This is a really exciting initiative. As you likely know, each president, regardless of which organization, has a theme. So the particular theme that has resonated with me is health equality. And I say that not just with me, but it's a sustainable model for a professional organization to take on science and social justice. So health equality as a theme means different aspects to different people. But we decided to really honor those who were committed and working in different aspects. So one of those awards is by Lynn Gerard at the University of Arizona. It's a very simple model of how to ensure that albuterol, which is an inhaler for asthma, is present in schools, and particularly in schools that really don't have the funds. Those students don't have the funds to have access to those medications. So that's one award, and I'll tell you how they were selected. And the second is Donna Appel, who's done an incredible job working on a syndrome called Hermansky-Pudlak syndrome. HPS, a genetic defect, but what her award has really centered on in providing diagnosis and translation for a Puerto Rican population that may not have access to all the therapies for those who speak English or on mainland United States. Those awards are chosen by 2 or 3 groups that have really resonated with health equality. One is the subcommittee that I appointed that will be an enduring model and will retain within the DNA of the ATS, and that's the Health Equality Subcommittee. And they chose one related to policy or that may make a difference, and that was the syndrome working with the Puerto Rican patients with HPS syndrome. And the other really had to do with the Clinicians Advisory and the chapter of council representatives. Those names may not mean a lot to folks, but those are folks for whom their very membership within those committees then selected them. So it was a competitive process. I'd like to just show you an example of what we're talking about. So these are 2 books. So the larger one is all the awards, so that's everyone who applied, and they are so striking. They're from trainees and nurses, physicians, postdocs, PhDs, and MDs, for whom science and social justice is very important. So they all competed for the awards. We only had 2 this year, but this will be an enduring model. The other is health equality, a scholarly discussion and analysis of why analysis of health equality is so important, and not just for respiratory health, our focus, but really for our patients and really good for society.